We all refer to it so frequently. I had a stressful day at work. Oh, my family is stressful. My job is stressful. We're feeling the stress with all the bills piling up. We all are experiencing it, whether it's a little bit of stress or a lot of stress. We're feeling it. Stress is the natural reaction that your body encounters when it experiences an external or internal challenge or change from its normal baseline environment. This can result in many different physical, emotional, spiritual, behavioral responses. Today, we're going to discuss stress, its treatments, how to diagnose it, how to recognize it, what symptoms it can cause, and much more about it. And we're also going to answer your healthcare related questions here on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their healthcare related questions. I'm Dr. Kamaljit Kaur, a double board certified primary care physician here in Coral Springs, and today we're going to talk about stress. I know I'm smiling while saying it. I'm just so excited to be here with you guys, but stress I know is not something that makes us smile. We're going to talk about what causes it, how to react or how we react to it, and really how we can learn to cope with it because stress is everywhere. Well, wouldn't you know, we already have our first question from our viewer, and it comes to us through our website, allhealthtv.com. This question is from Annabelle, and Annabelle asks, Dr. Kaur, I've had an ear infection for almost 2 months now. I was previously on amoxicillin, but it didn't work for me. I have now been on Ceftonir for about a week, and I'm still experiencing pain. I've heard that Augmentin is a good antibiotic, but I'm concerned about its side effects. I only have 3 pills left of the Ceftonir, but I don't feel any better. What should I do? Oh, Annabelle, I'm so sorry to hear that you're not feeling well. Ear infections, ear pain, it can be irritating even in the slightest, but to have something like this for over 2 weeks now, I'm so sorry. It must be so painful. Now, there's so much I could say on ear infections alone, but the point, and I guess the biggest thing I can tell you, the most important thing is if you've had an ear infection for more than 2 weeks, despite trying different antibiotics, then you really need to get reevaluated by your healthcare provider, your physician, to make sure that this really is an ear infection and nothing else is going on that can be causing your symptoms. And even though ear infections are more common in kids, adults do experience them. In adults, they're usually followed by a viral cold or really uncontrolled allergies. That's right. A lot of people don't know that uncontrolled allergies can lead to recurrent infections of the ear, the throat, the upper respiratory system, even the lower respiratory system. And honestly, controlling allergies sometimes is all that's needed to prevent them. But back to the actual ear infections when you do have them. Both amoxicillin and Augmentin are acceptable as first-line medications and treatments for this infection. If these aren't working though, we start to suspect that there's something more going on under there. It might be that you developed a new type of infection, or you had one kind of bacteria causing the initial infection, then a second type of bacteria came in, or that you might be on the wrong antibiotic, or that the antibiotic you're on just wasn't given for long enough, or, and most serious, that the infection you do have is so strong, or it's caused by a bacteria so strong that it's now leading to excessive symptoms, and that can even become more complicated. So the biggest thing, like I said, is to get reevaluated because we really want to make sure that we're treating the right thing there. I hope you feel better. Speaking of stress, there really aren't many things that are more stressful or anxiety provoking than a continued infection, especially an ear infection that just won't go away. For those that don't know, stress is the reaction that your body has when it's triggered by a threat or a challenge or a change, whether that's coming from outside or inside your body. But generally, once that threat or change or challenge resolves, so does your stress. Sometimes, though, this doesn't happen and stress can go on, and then that can lead to other symptoms. There's a lot of symptoms that you can experience when you're under stress. And here we'll go through some of them. One of them is difficulty sleeping. Whether you're stressed or have anxiety, those racing thoughts, that can keep you up at night and have difficulty sleeping. You can also have digestive issues. So, an upset stomach that you don't know where it came from. You can have chest pain, increased heart rate, increased sweating. You just feel anxious and fidgety. Speaking of, you can also be very restless when you're under stress. You can experience headaches, all different types of headaches. You can also experience increased muscle tension, especially in women. Studies have shown that we carry a lot of stress on our shoulders. We have a lot on our shoulders as it is, right? So, a lot of that stress can turn into tense muscle in the shoulders and the upper back area. You can have increased sweating along with that increased heart rate that I mentioned. You can have loss of appetite as well. And on the other hand, some people tend to eat more when they're stressed. So you can experience binge eating. You can also feel dizzy when you're really, really under a lot of stress. It's just your body's way of reacting to that mental stress. Speaking of mental stress, a lot of times it's also accompanied by feelings of depression, anger, and irritability and anxiety. So there's a whole slew of things that can happen when one is under stress. We have another question here, and this is a unique question from Sasha, and Sasha sends this to us through YouTube. Sasha says, Dr. Kaur, I was wondering if you could advise on what causes pain in the center of the belly button. Belly buttons, right, Sasha? So, belly buttons are in a location of your abdomen, basically your stomach area for layman's terms, that can be in front of a lot of different organs inside your body. So when you have pain in the belly button area, this can be pain coming from your intestinal system, some parts of your stomach sometimes, portion of your pancreas. And honestly, even though your kidneys are way in the back, they can actually cause issues that send pain to the front of your body. So a lot of stuff can cause belly button pain. And if you're experiencing it, especially if you're having other symptoms along with it, you really want to check with your doctor to see what's causing it and what you need to do to get tested or to figure out what's really going on there. So long story short, please get evaluated by your healthcare provider. Oh, the questions just keep rolling in today. So we have another one from Abby, and Abby reached out to us through Instagram. Abby says, hello, Dr. Kaur. How can I treat my hemorrhoids naturally? They tend to get worse in the summer. That's a pretty good question, Abby. And it is pretty well known that in the summer months and in the hot weather, there is a possibility for hemorrhoids to get worse. And a lot of different things can cause this. Most notably, when you're in high temperature, your body tends to increase your blood flow away from your digestive system and to your skin and to your extremities where it's needed the most. And this coupled with potential dehydration, because let's face it, a lot of us aren't drinking enough water to begin with. And then when we're out there in the heat, we are really at risk of getting dehydrated. So dehydration with the change in the blood flow can really cause dryness in your colon and in your GI system, and then that can worsen constipation, which in turn can worsen hemorrhoids. Excessive sweating also in these summer months and in the hot weather can lead to irritation and itching in the anal area, and then that is irritating also, right? Now, Abby, before we move further, we do have a nice video from the Mayo Clinic discussing more about hemorrhoids.
Hemorrhoids are a common reason for patients to come and see a doctor. If your hemorrhoids don't respond to over-the-counter remedies, that might be the time to seek care. Hemorrhoids are rarely dangerous except for patients who might be on a blood thinner medication where you could get excessive bleeding, or if the bleeding is excessive. Fortunately, surgery for hemorrhoids is rare nowadays, but it's for those patients who have ongoing bleeding problems or hemorrhoids that don't respond to conventional non-surgical treatment.
Now, that was some great information about hemorrhoids from our friends at the Mayo Clinic. In case you missed it the first few times, I do want to reiterate, here's another opportunity to find out where you can send in your questions for me.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube. or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. So our next question comes to us from YouTube, and this question is from Ted. Ted has a workplace question. Oh, and it couldn't be more topical. So Ted asks, Dr. Kaur, I have a very stressful job. Oh, I can understand that. And this job pretty much keeps me in the office for about 10 hours a day. I want to know what I can do to help alleviate some of my stress. Any suggestions? Oh, that's a great question, Ted. And yes, lots of suggestions. Now, some stress is okay, but if stress continues, it can actually be quite harmful to your mental health and to your physical health. People don't realize how negative of an impact stress has on your actual physical body. So important. That's why it's so important to take care of yourself and learn some relaxation techniques. Let's check out this video from our friends at Mayo Clinic, which provides some stress relief ideas.
Life in the fast lane is tiring on your body and your brain.
Studies show that our brain gets tired in about 1 to 2 hours of focused activity. So a lot of people are walking around with a tired brain.
Dr. Amit Sood is the author of the Mayo Clinic Guide to Stress-Free Living. He says giving your brain short breaks boosts efficiency and promotes creativity.
If you can capture those 3 or 5 minutes, you really get fresh.
And if shifting into a lower gear seems difficult at first, Dr. Sood offers this simple mind-quieting technique.
There's an exercise in our program, we call it FOND exercise, which is find one new detail.
At your desk, somewhere else at work, or even standing by your kitchen sink, wherever you are, search a familiar scene until you detect something you've never noticed.
I guarantee you'll be able to find something new, and that puts you into a discovery mode. We are, by design, a curious species.
And that can make life in the fast lane a happier ride.
That's some great advice from our friends at the Mayo Clinic. And Ted, I have some additional suggestions for coping with stress, and not just work-related, but stress in general. So here are some suggestions for coping with stress. Take deep breaths. Breathe in slowly through your nose, and then hold your breath for about 3 seconds and breathe out slowly through your mouth. It might help if you close your eyes and really listen to your breathing and just relax. Now, there's also guided visualization. Close your eyes. Picture a safe, peaceful scene. Choose a place that's special to you. Mountains, the ocean, the woods, wherever you feel the most calm and relaxed. What senses do you notice in your scene? What colors do you notice? What smells do you notice? What sounds do you notice? Then there's also progressive relaxation. This one's quite interesting. This involves sitting or lying down, and you start by making a group of muscles tense. So let's use our shoulders, for example. Tense up your shoulders and then relax them. And what you want to do is move from shoulder group to shoulder group. You might want to start at your feet and move up towards your head. And really that just helps you to be more conscious of the tension that you're experiencing and really the need to relax it. Then there's meditation. Meditation has been proven time and time again to be such a wonderful treatment and management for stress and anxiety. So try to clear your mind, which I know is difficult nowadays. Sit, lie down, whatever's more comfortable. Meditate while doing that, or you can meditate while doing other activities. I know it sounds counterproductive, but for instance, some people feel very calm when they're running or exercising. That can be a form of meditation as well. Then there's yoga or Tai Chi. Now, there have been a lot of studies done that show that Tai Chi helps with medical conditions such as hypertension or high blood pressure. So it definitely helps with anxiety and stress reduction as well. Now, these activities use a group of slow movements of the body, and this couples with deep breathing exercises. They can help with flexibility, with balance, with strength. Overall, it's a very wonderful whole body exercise. There's also mindfulness. This one's really good. This involves keeping your thoughts in the present and not worrying about past worries or future worries, but really just being mindful of where you are right now and being appreciative of what you have around you, what good things are around you, and really just to be in the zone. Then there's the one that I talk about a lot with my patients, nutrition. I know I say it a lot, fruits and vegetables, vitamins and minerals, but they really do help to increase your mood and to increase your the memory. That helps with concentration as well. Basically, a healthy, balanced diet containing plenty of fruits and vegetables can really help with your mental health and your immune system. The less sick you are, the more happier you are, right? And then there's psychotherapy. This involves meeting with a mental health professional and really talking about the things that are affecting you and causing the stress and causing the anxiety. This helps to reduce the stress and anxiety. And then mental health professionals through psychotherapy can also teach you coping mechanisms that really strengthen your resolve and your resilience to be able to deal with stress. Then there's prescription medications. We really try to avoid these, but if they're needed, there are some good medications out there that can help reduce stress and anxiety. These are very, very specific to each person, so please talk to your healthcare provider to see which one is best for you. And also take advantage of your support group. We don't realize it, but our support network, our friends and family, the connections we share with them, the venting we can do with them is very, very important for stress management. So you really want to make sure that you're getting the things off your chest that you can. So we have another really important question, and this one comes to us from Francine. And Francine reached out to us through our website, allhealthtv.com. Francine says, Dr. Kaur, I'm a senior citizen and my question is about vitamins. How many do I need? Do I really need a lot of them? And which is the best one? I can't stop peeing because I have to take water and these vitamins are making me sick. Oh, that's such a good question, Francine, because vitamins and minerals, we're not getting enough of them. Overall, we're just not getting enough of them, unfortunately. But there's different ways to get them. And the best one is through, yep, you guessed it, fruits, vegetables, and healthy whole foods. Those are going to be your best sources. Now, I know that not everybody can eat every vegetable on the planet or every fruit on the planet. You might be allergic to it. You might just not like it. So, it's not necessary that you're eating everything. And if you're not getting all the nutrients that you need to. And in those cases, yes, supplemental vitamins may be needed. Now, there's so many over the counter, right? So which one do you take? Well, the best people to ask are your healthcare professionals, so your physician, because you really want to take vitamins that are best suited to your personal medical conditions. You want to talk to the pharmacist. They generally know a lot about which vitamins are good, which ones have preservatives. You really want to be mindful of all that. But the most important thing, Francine, if the vitamins you're taking are making you sick, then I suggest you stop taking them and really talk to your doctor to see which one and what is best for you. If you've got questions, we've got answers. And just in case you missed it the first few times, here's yet another chance to find out where to send me your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Here's yet another interesting question that was just sent through our website, allhealthtv.com. This one comes to us by Jeff, and Jeff asks, Hi, Dr. Kaur. I've been having protracted bouts of violent spitting and coughing, not for weeks, but for months. Oh, wow, many months. The coughing is one thing, but the spitting up mucus phlegm is insane, sometimes 17 hours straight. The recent attacks have been so severe and debilitating that I was taken to the emergency room. I was prescribed 3 medications, including an inhaler for lung wheezing, even though I told the doctor I don't have lung wheezing, also hydroxyzine and prednisone. It's been a week and these meds just aren't making a difference. Any ideas? Jeff, I'm so sorry you're having such a difficult time. This is very complicated. Whenever you have symptoms, no matter what the symptoms are, and the initial medications aren't helping, I understand the frustration that you go through, because believe me, we feel it too. As your healthcare professionals and physicians, we want to do what we can and as soon as we can to make you feel better. So when it's not initially working, it's just frustrating all in general. So what I really encourage you to do is get back to your doctor, get back to your healthcare professional, and see if something has changed that's now requiring a new type of medication. Maybe there needs to be further testing done in order to really see what's going on down there. Now, having a chronic condition or having any kind of infection or something going on that just isn't going away is really a source of stress and anxiety. So in order to really take care of it, you need to get reevaluated, because the longer it goes on, the longer the infection might get complicated, or the process might get complicated. But then the stress that comes with it, that's going to make it worse also. Stress can really exacerbate certain health conditions, including respiratory issues. It can worsen coughing, it can cause chest tightness, so you feel uncomfortable. And chronic stress has been proven to reduce and weaken your immune system. So, whatever process is going on there, the more stressed you are, the less your body is going to be able to really fight it and take care of it. It's going to also contribute to a lot of inflammation, and that's going to contribute to your symptoms. So there's a lot of points here that need to be addressed. Stress can really, really trigger bad things to happen in the body. We all know this, but especially when you have something like that going on, it can make it worse. Additionally, stress can trigger any underlying conditions that you have. So if you have asthma, if you have COPD, it can make those conditions worse and then increase the coughing, the mucus production, the muscle tension, and really make those coughing fits even worse. So there's a couple different aspects that you want to look at here with your healthcare professional. Managing stress through relaxation techniques, mindfulness practices, exercising, and seeking support from your loved ones, your family, your therapist. These are all very beneficial methods of improving your stress levels and reducing any associated anxiety. And really, it just improves your overall well-being and potentially could take care of some symptoms that you're having too. But Jeff, I say it again, and I say it very, very emphatically. I really want you to get checked out again so we can really know what's going on and get you the best treatment and get you back to fighting condition as soon as possible. Now, the other thing is that stress can also sometimes mimic other healthcare conditions. So, point of the story is please get checked out. We have another question here that's come to us through Facebook, and this is from Cindy. Cindy's question is short, but it's right to the point. She asks, what helps memory? Oh boy, that's a loaded question because memory is something, for instance, we all think that with age, memory might go down or should go down, but that shouldn't be the case, and it doesn't need to be the case. If you're living a healthy lifestyle at the baseline, so you're eating well, you're eating whole nutritious foods, you're exercising, you're meditating or reducing your stress, you're avoiding risky substances like alcohol and drugs and smoking, and you have strong social connections with your friends and family and loved ones, believe it or not, that is a great formula for brain health and in turn for memory. If you find though that your memory is lacking or you're having issues with it, then I do suggest you talk to your healthcare professional to see if there's something else that could be causing it. Memory is something we all need, right? We all need to remember things and we all need to concentrate. There's a lot of over-the-counter things and supplements that say memory booster and memory enhancer, and they may be great. Some of them maybe work. I don't know. You can try them sometimes with the help of your healthcare professional and your doctor, but those aren't going to do much if your baseline lifestyle is not a good one. So if you're eating junk food all the time, not really going to help. If you smoke or if you are not exercising, if you're stressed all the time, no matter what tablets or vitamins you take, it's really not going to help your memory. So at your baseline, you should have a great lifestyle, and that's really what's going to help your memory the most. We have time for one more question, and this one is from Facebook. And this one comes from Danny. Danny asks, I've had hiccups and vomiting every day for 3 years, and the GIs can't find anything wrong. I've had weight loss and severe blood loss, but they can't pinpoint where it's coming from either. My whole life has changed, and this just isn't normal. You're right, Danny, that's not normal. That's actually very, very serious. Hiccups. We all know we get hiccups from time to time, and how annoying are hiccups, right? And there's different ways to get rid of them. People say scaring somebody, or drinking a whole glass of water, or chugging it really, really quick, or holding your breath for 30 seconds, or some of those shenanigans. We've all tried it, I'm sure. But even having hiccups for just a few seconds or minutes is irritating. So I can only imagine what Danny has been going through. When those hiccups start to become accompanied by vomiting, well, that's a sign that something more serious might be going on in the body. And especially when there's weight loss and blood loss, then you really want to make sure that there's nothing else that's being missed, because there's a lot of gastrointestinal conditions that can cause these symptoms. They can be simple conditions. We have conditions that might be inflammatory. And then we also have conditions that unfortunately might be cancerous. And you really, really want to make sure that that's not the case. So with vomiting, with hiccups, the weight loss, and then especially when we're seeing blood, that means something's going on in our GI system and we really, really need to get it addressed. So Danny, I hope you've seen a gastroenterologist. It sounds like you have, and you might have had extensive testing as well, but I think maybe they missed something, or maybe the condition has now changed and now there's other things going on that they need to retest for. So really, you want to be sure that you've had a very full evaluation. And under that full evaluation, you want to make sure that they've hit all the points that are necessary to really rule out any condition that could possibly cause this. They're going to look in the gastrointestinal system, but then there might be parts of the other systems that might be, nudging the gastrointestinal system and causing those symptoms. So you really, really, really want to make sure. Now, I have another question here, and this one says, what is the treatment for hepatomegaly? Well, hepatomegaly can be an enlargement of the liver caused by a lot of conditions. So if that's something you're experiencing, please talk to your healthcare provider, because you want to make sure you're getting the right testing, the right diagnosis, and then the right treatment so you can live happy, live long, live healthy. Well, that's all the time we have for today, folks. I appreciate you tuning in with me. I hope I was able to help. Be happy, be healthy. That's it for us here at Ask the Doc. Thank you for watching. We'll see you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.